And I think to start now.
Sure.
So, thank you so much, sir, to join. I would like to introduce Dr. Shirish Kumar. He's worked as a hematologist at Sir Gangaram Hospital in New Delhi for around 14 years. Uh, for 2 years at WHO headquarters, Geneva. For the past 10 years, he is working as an independent consultant with an international organization. And today, we are here for an awareness session on current global pandemic, which everybody is aware about. But I think an expert would be a better person to tell us all about these things. So I would request Dr. Shirish Kumar to please tell us something about the situation and the COVID rate. Over to you, sir.
Namaskar. Very, very grateful to you, Ankur, for inviting me. But before we start, a few things have happened with this pandemic, which is that anyone who's concerned with the medical field or even otherwise is an expert right now on COVID. So I do not take I don't take myself very seriously on that because I'm not a microbiologist, I'm not an immunologist, but I am aware of what is being done, especially at the WHO level here at the global headquarters and public health. So with that caveat in mind, and before I start, just a few things which I wanted to mention. One was that this is a viral disease and not a bacterial disease. So viruses are small infective agents which straddle the boundary between the living and the non-living. And they are so small that we can't even see them through our routine microscope in our laboratories. You need an electron microscope to see them. Second thing is, unlike bacterial diseases like tuberculosis, leprosy, pneumonias, and infections like that, where you have antibiotics to be used, viral diseases have very, very few drugs which are used. And most of the viral diseases which we have, like measles, smallpox, and others, we usually tend to use vaccines for them and very few drugs have come, especially after the HIV epidemic, antivirals have come. So that is one issue, that it's a viral disease and not a bacterial disease. Second thing is that with this happening, a lot of myths have gone around globally all over the world. And one, we do not know how this virus has actually moved from animals to humans. Which was the animal? We know that it is usually found in bats, but from bats, did it come to the snakes in China or in an animal called pangolin in China, which is normally these are eaten in that part of the world? We don't know. Two, we don't know why the virus is behaving so differently in different parts of the world. In North America, you have a large number of people dying, in Spain and Italy. Whereas when you look at our population in the subcontinent, India, Pakistan, Nepal, Bangladesh, Sri Lanka, or in African countries, we are finding a very different kind of epidemiological, or the people affected by the disease. We still do not know. It's all speculative. Could it be due to the vaccines we receive in India? Could it be because we suffer from more infections in India? Is it a warmer weather in India? It is all speculative, and I think it would be very wise for us to go by informed opinion, which is issued by the WHO or the governments or the CDC in the US, and not get swayed by things which are myths which are being propagated. That's the thing. And you can take over now, whatever you want to do.
Yes, there were some few questions from the everybody. So first question was, what are symptoms and complications that COVID-19 can cause?
Okay. One thing is that this is a disease which has been labeled by the WHO as COVID-19, Coronavirus Disease 2019. That's the name given to it. And this name has been given because it is caused by a group of viruses which are called coronaviruses. And we call them coronaviruses because these viruses have got small spikes on them, जो crown की तरह, मुकुट की तरह लगते हैं. So when you look at them, they look like a corona, as a halo around. जैसे बुद्ध के सर के पीछे halo दिखाते हैं. They look like a corona. So the name has been given coronavirus to it. In 2003, we had the first epidemic of coronaviruses because these are found usually in bats. Chimgadar ke andar zyada rehte hain, and from chimgadar or bats they get passed on to animals. We had a pandemic of SARS, severe acute respiratory syndrome, in 2003, where it came from bats to cats, and from cats in Malaysia and Southeast Asia it came to humans. In 2014, we had it in Middle East. उसका नाम दिया था MERS, Middle East Respiratory Syndrome. उसमें bats से camels में आया और camels से humans में आया. Now again, this is in 2019. It has come from bats to some animal in the Chinese animal market, and from there it has passed on to humans. So this is one thing. It's a coronavirus, so we call it coronavirus disease 19, and the organism is called as severe acute respiratory syndrome coronavirus 2, because severe acute respiratory syndrome 2003 में हुआ था, अब इसका नाम SARS-2 कर दिया है इन्होंने, WHO ने. So that's one thing. 80 to 90%, 85% of people will not even know that they have COVID disease. It is just like an ordinary flu with mild fever, sore throat, cough, tiredness, and it will pass off. And unless someone is tested, and viral testing is not easy, unlike bacteria जिसमें से आप culture कर लेते हो blood का, throat swab बना लेते हो, viruses को करना is a very difficult technique, and you use genetic or molecular techniques for which you need specialized laboratories. So there is a technique called as RT-PCR जिसमें आप नाक से swab लो या गले से swab लो और उसको फिर DNA को test किया जाता है, so which is a specialized thing. So it's not easy, and most people will not even know. 10 to 12% of people will have a more serious disease, and these people are elderly, more than 60, 65 years. People जिनको diabetes हो, hypertension हो, pre-existing heart disease हो, patients जिनको कोई cancer है या जिनका immune system affected है, they will have a more severe disease, और उनके symptoms होंगे breathlessness का, सांस का फूलना, छाती में दर्द, difficulty in breathing, turning blue, loss of consciousness, stroke-like symptoms, and they need hospitalization. And it is about 1 to 3% people who may not respond to oxygen therapy and other interventional therapy in ICU, who will not be able to survive this disease. So the fear of the disease should not be there. That it is an infective disease, but 80 to 85% of people will not even know they had it. The governments have put restrictions because we do not know who has it and who does not have it, and we don't want it to be passed on in the community. अगर हमारी OPDs और अस्पताल में खांसी जुकाम लेके अगर तुम लखनऊ में ही सोचो, if people land up, the health system will be overwhelmed कि हम, how will you treat so many people? हर एक आदमी को खांसी जुकाम बुखार हो रहा है. So that is
once you don't know that treatment,
and you can,
treatment
there is no treatment, and it is expensive. And it is expensive to be able to test everybody. So each government has put its own norm. Now they say South Korea has done it so well, they've tested everybody. Now in India, as we start testing, हमारे numbers बढ़ते जाएंगे. हर country की जो numbers आपको मिल रहे हैं और जो WHO collate करके छाप रहा है रोज, they are dependent on what is the norm being followed by the country. If you test many more people, the number of people who have got the disease will obviously increase. If you are not testing, you do not know how many people have the disease. And when you see the number of people who are dying who have the disease, that will depend on the number of people who have been tested. अगर आपने 100 लोग टेस्ट किए, उसमें से 10 लोगों की डेथ हो गई, तो आप कहेंगे 10% मोर्टेलिटी है. अगर आपने 1000 लोग टेस्ट किए, उसमें से 10 मरे, तो आपकी देखिए उतनी कम हो गई. आपने 10,000 लोग टेस्ट किए. So you see the data which Italy gives, Spain gives, UK gives, US gives, India gives, it is very, very variable because the number of people being tested and the number of people who are being reported is varying across country. So it is still not very clear. So as far as symptoms are concerned, it is like a normal flu, and this thing, only 5 to 10% people will have severe, what they call acute respiratory distress syndrome, ki pneumonia, सांस लेने में दिक्कत, you need oxygen and all. And the second complication, which is a major one, is which is seen in 15 to 20% of patients, but these are seen only in ICU patients. You will not find it ki घर में खांसी जुकाम में. It is only in the hospitals that you are finding it, is clot formation in the blood. So we just a thrombosis कहते हैं, and people keep getting these clots, they can go to the brain, they can go to the lung and cause pulmonary embolism, yeah, strokes and things like that. That is the usual presentation which is there.
There are two, three more questions, and I'll ask other people who have some questions can ask their questions. Two or three questions are there. How is COVID-19 and hypertension related to each other? And how can one's family cope with the added stress? What is right now with the people right now living under a lockdown? So they are going under a stress right now. And how is this correlated? How it can be avoided?
What has been seen is that patients who or individuals who already have a pre-existing disease, they are more likely to get more severe disease if they get infected by COVID. So one, hypertension is a very, very common thing in people more than 60 years across the globe. As you tend to grow older, your arteries become harder and you tend to have a higher blood pressure. So to think that people, they have still not been able to find that people with hypertension have a higher incidence of infection or not. It is because it is found in elderly and hypertension is seen in elderly. Therefore, you are finding that a lot of people with hypertension are having this thing. But there is nothing to show that if I have purely a hypertension, I'm more prone to getting it. It is not at all like that. Second thing, hypertension has come into importance is because this virus gains entry into the human cells through a receptor on cells which is called ACE2. एक तरह का एक रिसेप्टर होता है सेल पे जो हमारी बॉडी के ब्लड प्रेशर को कंट्रोल करने का जो एक एंडोक्राइन और हार्मोन का सिस्टम है उसके अंदर इन्वॉल्व होता है. वी हैव अ सिस्टम इन द बॉडी व्हिच कंट्रोल्स द ब्लड प्रेशर एंड द अमाउंट ऑफ फ्लूइड्स वी हैव इन द बॉडी, सोडियम, पोटेशियम, जो सॉल्ट्स होते हैं शरीर में. इसका नाम होता है रेनिन एंजियोटेंसिन सिस्टम होता है. इसके हार्मोन को एक्ट करने के लिए एक रिसेप्टर सेल पे होता है जिससे ये हार्मोन शरीर में काम करता है. यही रिसेप्टर जो है this virus is using to gain entry into the cells. This receptor is found in lungs, in the heart, in the kidneys, in the liver. So you would expect that these are the organs where this virus should be able to gain entry and cause disease. Second thing is, when you have hypertension, currently a lot of drugs which we give are against this ACE2 receptor. जैसे आपने नाम सुना होगा रैमिप्रिल, लिसिनोप्रिल, ये जब दवाइयां जो हाइपरटेंशन में दी जाती हैं, these are drugs which act against this ACE2 receptor. So there is this, that is why this term of hypertension and this thing has come to the fore, but it has no correlation. And what is more important, that people who are taking these medicines for hypertension continue to take these drugs because it has nothing to do with the virus, and you are likely to feel ill if you stop taking your blood pressure drugs. So hypertension and COVID are related like that. And as far as lockdown is concerned, Ankur, you know, it has medical aspects, it has social aspects, it has psychological aspects. You are confined to your home for 2 months now. People are used to going out, going for work and all. Schools are closed, so children are home. Everybody is confined into one place. You are not even able to go to your neighbor's place or go to the market. So those issues come into place. But the few things which are very, very essential, which all governments are following, is one, we know that this virus spreads through droplets. When we cough or we sneeze or we exhale very strongly, these droplets come out and the virus spreads. So they say, please maintain respiratory hygiene. जब आप खांसें, आप छींकें या आप थूकें, तो make sure that you are away from somebody. You cover your hand like this while coughing. Use a tissue or a handkerchief. That is your thing. Second thing is, you maintain physical distance because these droplets travel distance. If you are keeping 3 feet away, so everywhere in the world you are finding कि हर जगह वो लाइनें खींच रखी हैं कि 3-3 फुट की दूरी बनाए रखिए आप. You will not transmit the disease. Third thing is, if you have to go out of the house and you come back in, hand washing becomes very important because these droplets are there. Cell phone के ऊपर, दरवाजों के हैंडल पे, बिजली के स्विच के ऊपर, टेबल टॉप्स के ऊपर, मेजों पे. So all these things, so जैसे आदमी रोजमर्रा अपनी सफाई वगैरह करता है, it is wise to do it a little more and make sure that we keep these surfaces clean. This is particularly important in offices like yours, where people from outside are coming in. एक घर में जब लोग रह रहे हो, then अगर होना होती बीमारी तो हो जाती है if you are confined to the house. But if somebody comes from outside, आप सब्जी लेने जाते हैं, आप बाजार जाते हैं, you come in, wash your hand with soap and water for at least 20 seconds. That's the WHO norm. कि 20 सेकंड तक आप साबुन से पानी से अपने हाथ धोएं. You can use that alcohol rub which is there. And if you want, I will send it to you, then you can share it with the client. You can make this alcohol rub at home also. If you can just buy isopropyl alcohol, glycerine, and a bit of hydrogen peroxide, आप घर पे बना के रख सकते हैं because it's difficult to buy it now.
Please, and I'll try to share it. Yeah.
Because the WHO has given how you can prepare this thing at home and keep it. That is the third thing. Next thing is children. See, the schools are closed. You have to engage your children. Now, each family has its own norm. बच्चों को पढ़ाना. Many schools have started doing distance learning and all. Maybe everyone will not be having such a school where distance learning is there. So people have to spend time with their children and do it. So you have to engage them. Third thing is, I think if people have access to internet and things like that, this thing like Zoom call आपने की है, we can do it. I myself am doing it. Every weekend, I speak to all my relatives, my cousins on my father's side, on my mother's side, on a Zoom call. Most families are doing it. So, बच्चों को और घर वालों को, you are able to keep in touch with people and do it. So, these are the things. So, physical distancing, personal hygiene, and meticulous cleaning of surfaces, especially when you expose yourself outside. Now, suppose your child is playing outside. अब घर वालों के साथ तो ठीक है, लेकिन बाहर के लोग अगर पार्क में हैं या मोहल्ले के गार्डन में हैं, maintain that distance of 3 feet. That is very important. Second, do not let other children come to your house, because you are in the one house, it's fine, but playmates from other houses, the chances will be there, because then again the same thing is there. But it is important to see children have a very, very low chance of getting an infection. This one, unlike influenza or flu. So that is one reason most governments have started opening schools and things like that. The children are infected much less, fortunately, than adults are. So these are the normal precautions that one could take at home and in the workplace.
This COVID, has it some relationship with the weather?
Because this COVID virus is very similar to the influenza virus. And influenza virus we have seen since 1920s, when the first 18 के अंदर the pandemic आया था, it has seasonal variations which are there. But so far, the coronavirus has not shown any seasonal variation. There are 2 studies which have come out, one from Australia and one Canadian study which was published in the Canadian Medical Journal just day before yesterday, where they did study of 117 geographical areas taking into account humidity, temperature and all. So far they've said sunlight has no effect on the virus. About 2% difference was seen in the infectivity rate per rise of 2 degrees Celsius temperature. What they saw in influenza is कि जैसे summer के दिन आते जाते हैं, गर्मियां बढ़ती हैं, influenza कम होता जाता है. But you have seen in Singapore is hot, it is humid, and it has had the same this thing. So the countries still say that we will not go by this thing. Weather and all may be playing a role in it, but so far it is such a minuscule role that the disease causing capacity of the virus is much higher than whatever effect seasons, variations, or temperatures in different countries are showing. So we will continue to have the same laws of hand washing, physical differences, and things like that. So far, weather has shown no impact on it.
So there's a last question been asked. थोड़ा घबराहट होती है सबको while taking medications. So what are the medications that the person should avoid at this time? Normal medicines so आप मिलेगा ही, but what should we avoid?
2 facts on this. One, please do not stop taking any medication which you are routinely taking for any chronic disease that you have. Second, only medications which lower our immunity in any way are the ones which can impact on the behavior of this disease. That is anti-cancer drugs. People who get organ transplant, they are put on immunosuppressants. Patients having immune complex diseases like joint diseases and all, जिनके अंदर azathioprine and other diseases, other drugs which are given, which lower the immunity. These are the only drugs which can impact on it. But even then, before you do it, please try and reach your doctor or physician on the phone, on the email, on WhatsApp to say, मैं अपनी दवा बंद करूं कि ना करूं. By and large, you will continue to take your same treatment, and this will come into play, especially in the elderly. If you are more than 60, 65, and you have a disorder which you have to take immunosuppressants, there it may make sense to contact your doctor to check कि should I continue. हमारी immunity कम होती है. देखो, there are certain diseases जिसके अंदर हमारी खुद की antibodies खुद के शरीर के अंगों को अटैक करने लगती हैं. They are known as autoimmune disorders. There are a whole lot of them which are there, like rheumatoid arthritis, ankylosing spondylitis. बहुत है. Skin की diseases हैं, joints की हैं, बहुत है इस तरह की. उनके अंदर ये दवाइयां दी जाती हैं कि आपका शरीर एंटीबॉडी कम बनाए, जिससे आपको your symptoms become less because your antibodies don't attack your own body, and you need antibodies to fight infection also. So that is the only group of individuals where you can restrict your medicine. Otherwise, you continue to take your own medications. Second thing, whenever you have any flu-like symptoms, what do? You normally take a crocin or a paracetamol. You take gargles. You take a lot of fluids, which you take bed rest. You keep your windows and all open and keep the ventilation better. You maintain hygiene and things like that. That is the standard, this thing which has to be done. Nothing more than that. Only thing is, if you start getting breathlessness, if you start getting chest pain or pressure on the chest, if you start turning blue, or if there are symptoms कि brain effect हो रहा है किसी कारण से, palpitation हो रहा है, then you need to go to a hospital. Otherwise, most of this flu kind of thing will pass off at home, which you don't normally bother.
I'll request some of my other guests who have some questions can raise their questions. That anything related to we can unmute.
Hello.
Yeah.
So, Dr. Shirish, hi. My name is Rahul, and I have a small, very general question in regards to COVID-19. How important is the role of mask? Because this is a day-to-day thing that we will now, going forward, we will have to use. And how to maintain a proper sanitization of the mask going forward for all those people who are going outside?
Absolutely. See, the WHO does not prescribe masks per se. It says if you are having symptoms of flu, then you wear masks. But you know, it is so difficult. If you were to go to the market and you have to stand close to people, how do you know does this person has or does not have? So it is safe to wear a routine ordinary mask. आप अगर घर की पुरानी धोती से भी 3 लेयर करके सिल के नाक पे बांधे, that is a very, very effective mask. But if you buy a surgical mask, few things are very important. One, before you wear that mask, please wash your hands with soap and water. 2, you touch the mask from behind, not the front of the mask. 3, while you are using the mask, you will keep using it till such time it becomes damp. When it becomes damp, that is the time you have to discard the mask. It becomes wettish and damp because of your breath. 4th thing is, there should be no gap between your nose and face and the mask. So you try and put it in a fashion that it comes close to you. And 4th, when you take off the mask, you take it out from behind your ears, not from the front, which is infected, and you dispose it in a bin जिसके अंदर lid लगी हो, किसी bin के अंदर बंद उसके अंदर आप करें. So, 2, if you have to take your child out or if you go out, it is always safe to wear a mask, though it is not mandatory. Second, if someone in the house has got infection and you are not sure, it is wise for that person to wear the masks within the house so that घर वालों के अंदर spread होने की संभावना कम रहे. That is the few things. Would that answer your question?
Yeah, actually, thanks, Dr. Shirish. Yeah, really it's answered the question. Thanks.
So please go ahead.
Good morning, sir. This is Ashish Wesley this side, and I'm very thankful to Ankur also to arrange this meeting. Quite a lot have been told, about coronavirus, how to deal with it, what are the symptoms, and what are the vaccines also working out, and even testing also. But being an Indian, and India generally face one problem, that this COVID-19 testing takes 2 to 3 days to come out, the results. Sometimes, especially, okay, now as per WHO, you have already, some of the officials have told that there is a issue that we have to live with this coronavirus. There may not be any vaccine coming out. So imagine now if the life starts again and somebody has to emergency go for join some place, go for an official meet, to fly somewhere. So that means this guy has to stay and do 2 to 3 days waiting, then do a test, and maybe he goes to other country and sit there in the airport, do a 2 3 day test, then again he can go. So what is WHO doing to actually testing? Vaccine is there, but what are the new methods they are trying to do to shorten the testing part of it? Especially in India, you see how many migrants are coming, and they are asymptomatic also. So these guys will come, somebody will do their test, and to for a state government to put them in a isolation place for 2 3 days until the test comes out, it's become tough for them. So I know vaccines are being worked out, testing has been done. So anything working out on this part where you can shorten the test? I know it's a virus, it takes time, but we are humans and we have technologically excelled and we are working. So I just wanted to know if anything has been worked out on this part of it to shorten the test and get it confirmed fast as you can. And this will be really helpful on a common level platform also.
There are two ways of doing the COVID-19 test. One is कि आप वायरस को टेस्ट करें. दूसरा तरीका होता है कि वायरस आपके शरीर में है तो आपने उसके खिलाफ एंटीबॉडीज बनाई है तो आप ब्लड में एंटीबॉडीज टेस्ट करें. There are the two ways. The better way to do is to check for the DNA of the virus in the person. तो नाक का स्वॉब या थ्रोट का स्वॉब जो आप बार बार पढ़ते होंगे कि रिवर्स ट्रांसक्रिप्ट PCR टेक्नोलॉजी, RT-PCR टेक्नोलॉजी हो रही है. Now, this is completely dependent on how rich a country is. South Korea जैसे देश ने nearly 70% of their country's population को RT-PCR कर लिया. RT-PCR करीब 7,000 से 10,000 की कॉस्ट है. हिंदुस्तान में आप सोचें आप कैसे कर पाएंगे RT-PCR? तो आपको नॉर्म्स बनानी पड़ेंगी कि किन को मैं टेस्ट करूं. तो पहले शुरू किया जो आदमी बाहर से आ रहा है जिसका एक्सपोजर हुआ हो उसको मैं टेस्ट करूं. फिर आपने कहा कि ऐसा करते हैं बिकॉज द सिम्टम्स टेक 5 to 6 days to 14 days, 14 दिन तक मैं अलग रखता हूं और सिम्टम्स आदमी में आए तब मैं टेस्ट करूं. अब इफ यू लुक एट इट from a very human point of view, it is unfair. But it is, what does a country do? A rich country which has invested in its health systems will be able to test all its people. A country which is not able to invest so much will have to set norms कि मैं किसको टेस्ट करूं, किसको टेस्ट नहीं करूं. So ultimately हम लोगों की टेस्टिंग जो सस्ती पड़ेगी will be for the ELISA test in the blood to testing for the antibodies. लेकिन एंटीबॉडीज भी शरीर के अंदर इन्फेक्शन के 10 से 14 दिन बाद आती हैं. तो माने मुझे इन्फेक्शन हो 14-15 दिन तक मैं रहूं उसके बाद एंटीबॉडी आए. फिर you have to create the test kits. You have to make sure that the antibody which it is testing, is this the antibody which protects you also, or it is just the response of the body to the virus? उसके खिलाफ भी तो is it a neutralizing antibody या non neutralizing antibody? मैंने कोई फायदा भी है इस एंटीबॉडी का या ऐसे ही बन गई है प्रोटीन के खिलाफ? तो WHO जो है, जो ट्रायल्स हर देश में चल रहे हैं, और WHO ने एक वेबसाइट बनाई हुई है जहां पे 56 कंट्रीज ने रोज कर रहे हैं कि हमारी कंट्री की फार्मा इंडस्ट्री ये वाले किट्स डेवलप कर रही है. तो जब ये किट्स डेवलप होंगे और आने मार्केट पे आने के पहले WHO नॉर्म्स देगी कि इज इट अ वैलिड किट. यूएस में क्या हो रहा है, देयर इज सो मच ऑफ फेक दिस थिंग गोइंग ऑन दैट पीपल आर यूजिंग अ फ्रॉड. The pharma countries, I have read in the articles that pharma countries have given false kits saying that you test it and it will immediately tell you, and people are so vulnerable and so worried कि आदमी तो टेस्ट करने के लिए कुछ भी खरीद लेगा करने के लिए. So this is going on, but जैसे आपने कहा, this will take time, but ultimately it is the molecular techniques of PCR testing for the DNA or the mRNA of the virus, which will a definitive diagnosis, but we will ultimately have to move towards the antibody testing. This thing, how long it will take is very difficult because these technologies, these technical platforms take a while to develop. Then each country or each nation's governments have to give approval for it, for this thing. So it will take, but WHO is definitely working on it. But this is a hardship we'll have to face, because rich countries will be able to test all their people. Countries which have less money will not be able to test. I'll tell you, my daughter is working as a pediatrician in UK. They were put in the ward to work with adult COVID patients, क्योंकि वहाँ पे doctors की इतनी दिक्कत हो रही थी. The doctors working themselves were not being tested in UK. ये मैं personal experience से बात कर रहा हूँ. तो I was surprised कि UK तो G5 country है भाई, वहाँ पे अपने ही डॉक्टरों को वो टेस्ट नहीं कर पा रहे थे, उनके टेस्ट किट्स नहीं थे उनके पास. फिर जब आए और वो शुरू हुआ, तो you know, this will vary from country to country, and there is no one answer for it, and we'll have to live with this thing. But definitely the WHO is working on both these things, and what it can do is to say that this kit is WHO approved. That is all that WHO can say. Then हर country के health system और ministry पे depend करता है वो market में उसे देती है कि नहीं देती है. Would that be okay?
Yes, sir. Yes, sir. Thank you. Thank you, ma'am.
Are there any other questions or people who want to ask something?
Hi, Ankur. This is Adarsh here.
Hi.
Good afternoon, Dr. Sir.
Good afternoon.
So, we understand there are some common symptoms which have already been, in circulation, and we all know that. But has there been any other development in terms of symptoms like sores on fingers or some physical symptoms which has also come, that if it is there, then that means that is a sign of infection?
Yes, absolutely. Absolutely, they are there. Do you know the commonest symptoms, as we've just mentioned, are these of sore throat, cough, and fever, and things like that. The more severe symptoms are pneumonia-like symptoms, breathlessness, chest pain, loss of speech, or bluish lips, inability to walk and all. But there are a whole lot of symptoms. For instance, about 3 weeks back, they have found a syndrome which is seen in children, which has come out in Northern Europe and in North America. जो एक disease होती है कावासाकी disease, उसकी तरह है, जिसके अंदर जो आप बता रहे हैं कि बच्चों की उंगलियों के अंदर there is rash, there is blueness, there is rash around the lips of the children, they have high fever, and they have an acute immune response which is there. But this is seen only in children who have been admitted to the hospital. So these kind of rare symptoms are there, but I don't think as a person who is not working in a hospital, one needs to concern oneself with what the rare symptoms are, because the disease can affect kidneys. So you will have symptoms of kidney which can be there. The disease can affect the liver. So there'll be very unique features. It can affect the heart. So you may have symptoms of myocarditis. Myocarditis means heart failure जैसे होगा, छाती में दर्द होगा, palpitation, arrhythmias, electrical disturbances of the heart. But you know, as more and more publications and experience of doctors in different parts of the world keeps coming in and reports are published, these symptoms will keep increasing. But to able to say कि किस patient में कौन सा symptom होगा, किस part of the world, because हम लोग की ethnicity भी है, we are different from Chinese, we are different from whites. हर community के अंदर थोड़ा थोड़ा परिवर्तन रहता है कि you find that certain things occur more in some groups, some in less. So it will be difficult to generalize. So one would only look at symptoms which are commonly seen and all. Otherwise, जो चीजें मैं बता रहा हूँ, they will be looked by doctors in an ICU. He would look for these things.
Thank you.
I think the questions have been, like, most of the questions have been asked, and I would now like to thank you, sir, for taking out the time and guiding us out this pandemic. And if required, I'll be again troubling you. And
Sure.
I would,
And
I would, if there are people like who want to again connect, and if there are people who are not able to connect today and can connect sometime,
Sure.
so I would request you to please
And then
take out some time. And
you are being very polite in saying taking my time out. Time ही time है. टाइम with the lockdown, तो आप उसकी फिक्र ना करें. That way. Good to talk to you.
Thank you so
Nice
much,
of you
sir.
to invite me. Thank you so much. Thanks so much, Uncle.
Thank you so much, sir.
Thank you, sir. Thank you.